Good morning, everyone. First of all, I want to thank you, the organizers, and especially to Vanessa, for the invitation to be here. I'm very honored to be in such a wonderful meeting and to meet such wonderful people. Well, what Vanessa asked me was to make a simple introduction about IEF. IEF is isoelectric focusing of transferrin as a diagnostic for CDG and glycosylation defects. So before that, we have to go into basic biochemistry. So what are proteins? Proteins are chain of amino acids, and they are special molecules because they are amphoteric. What does this mean? It means that in a special environment, they can carry either positive, negative, or zero charges. It depends on the pH of the environment. Glycoproteins are a special class of proteins. They are called the sweet proteins. They consist of a protein bounded to a carbohydrate structure. And they are very important. Why? Because they participate in almost every biological process. The saccharide, or the sugar chain, can be linked to the protein in two major ways, either N-glycosidically or O-glycosidically. We dedicate ourselves in this presentation to the N-glycoproteins. They are a special family in which the glycan structure is linked to the protein through a bond between the sugar of N-acetylglucosamine to the nitrogen atom of the amino acid asparagine of the protein. Why is transferrin a valuable resource to study CDG? Because it's a plasma N-glycoprotein with two glycosylation positions. You have heard that it's a iron transporter. Its glycosylation is affected in most CDGs. It's very abundant in plasma, so plasma is very accessible through blood collection. And the glycans can be B3 and tetrabranched, and each branch terminates in a sialic acid molecule that is negatively charged. The most common isoform is the tetrasialic form. Here represent what we call the microheterogeneity of the transferrin that help us to make the diagnosis. So let's now focus what is isoelectric focusing. It's a protein purification and fraction technique, and it's performed on a pH gradient. It combines what we call an isoelectric point and electric fields. The isoelectric focusing uses the theory of a protein isoelectric point. What is the isoelectric point? It's the pH in which the protein has a neutral overcharge. Then the positive charge equals the negative charges. So it's a technique that concentrates proteins at their isoelectric points. The isoelectric points are very specific for each protein. So they separate proteins based on a small charges differences. The separations, as I said, occurs influenced by an electric field. So once again, I'm showing a cartoon to illustrate what is isoelectric points. The isoelectric point is when the protein reaches the net charge 0. This is the negative and the positive charge equals to 0. And that is the isoelectric point. So, going back to the transferrin and its microheterogeneity, if the sequence of amino acids in the protein is the same, the number of sialic acids help us to separate these micro differences between the transferrin. So we prepare a gel with small molecules that we called amphylines that after electric field create a gradient of pH. In this situation, when we apply a protein, the protein will move to her isoelectric point and stops when it reaches the isoelectric point. This is a scheme in which I explain how is the procedure to the transferrin isoelectric focusing. So we begin preparing the gel with those small molecules that create a pH gradient. Then the transferrin present in the serum is put on the gel and is submitted to an electric field on the fast system apparatus. Then the transferrin is incubated with the antibody and then stained, and after drying we do the pattern identification and densitometry to see the percentage of each band. So here I present a normal pattern of transferrin. As you see, the most abundant fraction is the tetracell band. But in case of CDG, we can find abnormal patterns with a huge increase of the 2-cell band and also an increase in acylo transferrin, in which there are no occupied places in the glycosylation positions. We can also find abnormal patterns in which there's a huge decrease of the tetracell band along with an increase of the 2-cell band in these Golgi effects. But the diversity of these patterns is enormous, and things aren't always cut through simple. So one thing we can find about the pattern in isoelectric focusing is that it can give us a clue about where is the defect location. Nevertheless, we have false positive isoelectric focusing in transferrin patterns. We can have abnormal pattern due to abnormal blood collection in EDTA. We also can have other metabolic disorders that causes abnormal pattern, and also not so common situations that we found in a patient with a serious infection of EBV virus. There's also normal variants in transferrin. What we call it polymorphism. Polymorphism are due to normal variation in the protein. This is, for example, we have a suspected patient, and we looked, but we thought it could be a transferrin polymorphism, and we asked for the parents to collect sample to see and to confirm that the pattern was due to transferrin polymorphism. As you can see, the father has a similar pattern as the suspected patient. Another way, if we can't have the parents' samples, we can incubate with an enzyme that is called sialidase. This sialidase cuts the sialic acids in the transferrin glycostructures, and the transferrin isoelectric focusing depends only on the charges of the amino acids present in the sample. That is, this patient inherited a different form from the mother and another form of transferrin from the father. So, in a normal way, in a normal situation, we only have one band. In this variation, we have two bands. One that is inherited by the mother and another that is inherited by the father. In conclusion, transferrin isoelectric focusing is still a very useful first-line technique to identify CDG due to N-glycosylation defects. Still, transferring isoelectric focusing can give us clues about defect location. As I said, transfer is very abundant and accessible through plasma, and the isoelectric focusing equipment is affordable, which is very important in this context of world crisis, and that laboratories don't have huge amount of monies to buy complex apparatus to make CDG diagnosis. So thank you.